Hey everyone. I want to do a little bit of uh, educational video here, just on the hidden costs of Medicare that no one tells you about, and then most importantly, how to avoid them. So I'll ask you this: did you know that Medicare isn't actually free, or that some people end up paying thousands in unexpected costs they never saw coming? Well, today I'm exposing the hidden costs of Medicare, the ones that can cost you a fortune if you don't know about them. Stick with me because by the end of this session, I'll show you exactly how to avoid these pitfalls and save thousands of dollars. Heck, I remember a story talking to a woman. Her name was Cindy. She had just turned 65 and was pretty excited when I stopped by her house. And she said that she thought that she already had everything squared away with Medicare, and she didn't need any help with anything. I said, no problem. I gave her my card and said, if you need anything or change your mind, give me a call. A few months later, she was hit with unexpected medical bills that she had no idea that was coming. She called me practically in tears and said, "I thought Medicare covered everything. Why am I getting these bills? Why didn't you warn me?" And I laughed inside a little bit. Well, I did say, there's other options that are available, but she assumed that she already knew everything, which I guess I would say that is one of the biggest things that you want to make sure if you're going into Medicare or know somebody who is that you need to work with an agent. Don't just do like a call center and don't just assume. Make sure it's somebody that's going to give it to you straight. Make sure that they tell you what's good and what's not, or as I like to say, what's good and what's garbage. But Mary's story, or excuse me, Cindy's story, really isn't unique. It happens all the time. So today, I'm making sure this doesn't happen to you. So if you could drop a yes in the comments if you've ever been surprised by a medical bill, and I'm saying either on Medicare or otherwise. So just go ahead and put that there. And also, of course, as you already know, make sure you like and share this live because I guarantee you someone you know needs to hear this. Okay, so hidden cost number one, we'll say. Now, I say this is hidden, but this stuff is available, but not everybody knows what to look for. So that's why we're looking to keep these. You'll see tons of Medicare videos that are looking to explain this stuff because it's important. We want people to know what's out there. We don't want people getting surprised. All right. So Medicare isn't free. That's a myth. Is that Medicare is free, and the truth for most people, it's not free. And here's what you actually pay. Part A, that's hospital insurance. Free only if you work 10 plus years. If not, up to $505 a month in 2024. Right. And Part B, doctor visits and outpatient care, everyone pays a standard. We're right around 185 bucks a month right now for 2025. More if you're in a higher income. Deductibles and copays before Medicare pays you owe about over $1,600 of hospital deductible and 20% of outpatient costs. The thing I would ask is, did you already know about these costs? And type a yes in or no in the chat if you could, just so then I know where we stand. And also, too, you can always reach out to me here. You can go right to my website at chrisneupauer.com/Medicare. That'd be KRISNEUPAUER.com/Medicare. Now, if you want to avoid surprise bills, you need a plan that covers these gaps. More on that in a minute. Hidden cost number two, prescription drug surprises. The myth that Part D covers all of my prescriptions. The truth is, not always. Many people get hit with unexpected drug costs, and here's why. The donut hole. Once total drug costs hit $5,030, you pay 25% of the costs until you reach a catastrophic coverage. Not all drugs are covered. Every plan has a different formulary, basically a list of covered drugs. There's also late enrollment penalties. If you don't sign up when you're first eligible, you pay a lifetime penalty. And that's something you want to make sure obviously you can avoid. No one wants to pay a bill forever. So let me ask, have you or someone you know ever been shocked by the cost of prescription drugs? Let me know in the comments. Okay. So here's your solution though, is check your plan's formulary every year and consider a Medigap or Medicare Advantage plan with better drug coverage. Number three, Medicare Advantage limitations. Okay. The myth here, Medicare Advantage is free and covers everything. The truth is, Advantage plans can be great, but here are the hidden costs people don't expect: the copays and out-of-pocket costs. Even with a $0 premium, you could owe thousands of dollars in copays. Network restrictions and many plans are HMO or PPO, meaning out of network doctors cost more or aren't covered at all. Referrals are also needed too, and you often need a referral to see a specialist. The thing you want to ask is, do you prefer freedom to choose your doctors, or are you okay with networks? And the solution is, if you want fewer out-of-pocket costs and the freedom to choose any doctor that accepts Medicare, a Medigap supplement plan might be better for you. Now, when long-term care comes up, this is a hidden cost here too. Long-term care isn't covered. All right. The myth is Medicare covers nursing homes and long-term care. The truth, Medicare only covers 100 days of skilled nursing care after a hospital stay. It does not cover assisted living, home care, or long-term nursing home care. The average cost of a nursing home is $8,000 a month, and it could be a lot more. All right. So, who here has had to pay for long-term care for a loved one? It's expensive, right? The best way to prepare for a long-term care insurance, Medicaid planning, or saving strategy. How to avoid these hidden costs? Okay. A summary of the four hidden costs, which is Medicare isn't free, prescription drug costs can be higher than expected, Medicare Advantage has out-of-pocket surprises, and long-term care isn't covered. What you can do now: review your plan annually to avoid coverage gaps. Consider Medigap if you want fewer out-of-pocket costs. Check your drug coverage to avoid the donut hole, and look into long-term care options now before you need them. So here's what I can say, just coming close towards a wrap up here, is you could call, or excuse me, call. You can always call me here, or you could always go right to my website and get a free consultation. Okay. So I want to ask real quick here, who who found this helpful? Give me a thumbs up in the comments if you could. And then again, if you want to make sure you don't get stuck with hidden Medicare costs, let's talk. I'm offering free Medicare plan reviews this week, where I'll help you find the right plan for your needs and budget. Make sure you're not overpaying for coverage. Answer any questions you have completely free. Okay. The free here isn't Medicare. The free is going to be the consultation with me. So drop a comment below or DM me review, and I'll personally reach out to you to schedule a free review. You could also throw me a text at 320-400-7353. You could you could book it directly here in the description. I have the link to my website. So I just want to say thanks for joining me today. If you got value in this, make sure you like, share, and follow for more Medicare tips. I'll be back soon with more ways to help you save money and to get the best healthcare costs possible. So I'll see you in the next live. Thanks so much for joining me. I really appreciate it.